Panginoon naming Diyos, maraming salamat sa panibagong araw na ibinigay ninyo sa amin. Bigyan mo po kami ng lakas at pagkalinga sa pagtupad ng aming mga gawain. Patnubayan mo kami sa aming bawat desisyon. Pagpalain mo ang bawat isa sa amin. Ang aming mga magulang, kaibigan, kapatid, katrabaho, at sa lahat ng mahahalagang tao sa buhay namin. Patuloy ninyo po sana kaming gabayan sa mga bagay na aming gagawin sa araw-araw, upang patuloy naming magampanan ang aming mga tungkulin. Amin kong hinihiling ang lahat ng ito, sa pangalan ni Hesus Kristo.
So, what is COVID-19? Coronavirus disease 2019, also called COVID-19, is caused by a virus that can be passed from person to person. It first appeared in people in December 2019 and has quickly spread around the world. COVID-19 affects your respiratory system. In some cases, it can cause problems with your lungs, like pneumonia. There is a lot out there about COVID-19. Guidelines and recommendations are changing quickly as we learn more about the virus and how it acts. Trying to keep up with what to do and what not to do can be confusing and overwhelming. So let's break it down. Let's talk about what is going on and what practical steps you can take to keep you and those around you safe and healthy. How does COVID-19 spread? The virus is spread through droplets, so when an infected person coughs or sneezes, they project droplets of the virus out into the air. Those droplets then land on or are breathed in by other people. That's the most common way the virus can spread. Another way it can spread is when those infected droplets land on surfaces like door handles and elevator buttons. If a healthy person touches the surface that has droplets on it, and then touches their eyes, nose, or mouth, it's possible for them to get sick. These are gateways for the virus, so the less you touch them, the less chance there is for the virus to enter your body. That's why everyone keeps saying, don't touch your face. If the virus gets on your skin, like on your hand, you want to wash it off by using soap and water or hand sanitizer before it reaches your eyes, nose, or mouth. It may be possible for a person with COVID-19 to pass the virus to others when they aren't showing signs of being sick. This is called asymptomatic transmission. It often takes 2 to 14 days before people start to feel sick after being exposed to the virus. So you could be getting other people sick without knowing it. That's why when there are a lot of cases of COVID-19 in an area, leaders recommend staying home unless you really need to do something, like get groceries. And if you are feeling sick, stay home and call your doctor. What are COVID-19 symptoms? Some signs of being sick with COVID-19 are a fever, cough, body aches, and trouble breathing. Some less common symptoms of the virus include headache, sore throat, runny nose, problems with sense of smell or taste, nausea, and diarrhea. I know it can seem like anything can be a symptom of the virus, so if you aren't feeling well, stay home and call your doctor. Most people who get the virus will experience mild symptoms. Some people won't experience any symptoms at all. Most people, including children, who get sick with COVID-19 can recover at home. But for some people, especially people who are 65 and above, people who have other health problems like lung conditions, diabetes, and heart disease, and for people whose immune system or infection-fighting system doesn't work so well, COVID-19 may lead to more serious problems that require hospitalization. What should I do if I'm feeling sick? If you are feeling sick, have a fever, cough, or are having trouble breathing, call your doctor or local urgent care facility. This is important. Call first. And if you are sick, cover your nose and mouth with a cloth mask, scarf, or handkerchief. It will help protect the people around you. If you live outside the United States, check with your National Health Agency on mask recommendations. When you call, your doctor can tell you what to do next. Some people may need to come in and be seen by a doctor, and some people may need to stay at home and limit their contact with other people. Your doctor can tell you what you should do. What should I do if I'm worried I've been exposed? Your chances of exposure to the virus that causes COVID-19 increase if you are within 6 feet of someone who is infected, about the length of a bed away from them. You live in or have traveled to a location that has a lot of cases, or you were at a crowded event with someone who is infected, like a party. If you think you've been exposed to someone who has COVID-19 but aren't having any symptoms, call your doctor, hospital, local urgent care facility, or public health office. They can tell you what to do next. If you think you might have been exposed and you have symptoms like fever or cough, you should call before going to your doctor's office or to a hospital. Your doctor can tell you what to do and if you need to be seen in person. If you are asked to come to the hospital, you may be asked to follow special procedures, like using a special entrance away from other people and covering your nose and mouth. It's important to know that currently there is no proven treatment for COVID-19, but doctors can help support your breathing and make you as comfortable as possible. Most people will not need to stay in the hospital and will be able to make a complete recovery at home. What can I do to stay healthy? Wash your hands with soap and water. Really, I know it sounds simple, but it has a big impact. Basically, it's because soap breaks apart the container that holds the virus. Once the container is open, the virus just washes away with the water. For this to happen, you gotta spend some time washing your hands, and you need to scrub. You want to wash your hands for 20 seconds. That's the happy birthday song 2 times. You'll want to rub your hands together, clean your wrists, fingernails, in between your fingers, and dry your hands with a paper towel you can throw away. Lastly, turn the water off using the paper towel instead of your hand. Now, if you have kids in your household, make sure they're washing their hands this way too. If you aren't around soap and water, use hand sanitizer that is at least 60% alcohol. Make sure to rub it in until it's dry. What else can you do to stay healthy? You'll want to keep your distance from other people. This is called social distancing. And you really want to stay away from people who are visibly sick or coughing. If you can, work from home. And speaking of home, clean surfaces that you use frequently. Clean doorknobs, countertops, your phone screen, and other items you touch a lot. Lastly, it is a good idea to limit travel to places that have a lot of COVID-19 cases. Okay, let's talk for a quick minute about what doesn't help protect you against COVID-19. It doesn't help to hold your breath if someone sneezes or coughs around you. The virus can be passed in multiple ways, so not breathing around people doesn't really do anything. Let's also talk about masks. If you live in the United States, check cdc.gov/COVID-19 for the latest recommendations on masks and face coverings. If you live outside of the United States, check who.int or your national health agency for recommendations. How can I help slow the spread? I know COVID-19 sounds scary, but there are some good things to keep in mind. For most people, COVID-19 is a mild infection that is not life-threatening. You can do a lot to keep yourself and others healthy by washing your hands, staying away from people who are sick, wearing a face covering, and practicing social distancing. Remember, if you are feeling sick, stay home and call your doctor. By taking these practical steps, you can protect yourself and those around you and help slow the spread of the virus. And you can stay up to date with the latest guidelines and recommendations at www.who.int or your national health agency.
Mental health and psychosocial support for parents and learners. Magandang araw po sa inyong lahat. Bilang magulang, pangunahing obligasyon po natin ang matugunan ang pisikal at material na pangangailangan ng ating mga anak, kagaya ng pagkain, damit, tirahan, edukasyon at kalusugan. Ngunit, mahalagang pagtuunan din natin ng pansin ang kanilang pangkaisipang kalusugan o mental health. Lalo na po sa kasalukuyang sitwasyon na may kinakaharap tayong pandemya. Bigyan po natin ng tumbas na halaga ang pampisikal at pangkaisipang kalusugan. Makikita po natin sa larawan ang mga pisikal na pangangailangan na nararapat nating ibigay at gawin sa ating mga anak. Nariyan po ang masusustansyang pagkain gaya ng gulay, prutas, gatas, itlog, karne, at marami pang iba. Ligtas, payapa, at may seguridad na tahanan. Wasto at sapat na ehersisyo. Immunization upang masiguro na protektado ang ating mga anak laban sa mga sakit. Sa mental health o kalusugang pangkaisipan, ano-ano naman po ang pangangailangan ng ating mga anak? Unconditional love from the family. Pagmamahal, seguridad, at buong pusong pagtanggap ng bawat pamilya. Kailangang maramdaman ng mga bata na ang ating pagmamahal ay hindi nakadepende sa kung ano ang nagawa o na-accomplish nila. Halimbawa, sa kanilang grado, mataas man o mababa, patuloy natin silang suportahan. Unawain at tulungan silang idiskubre, linangin ang kanilang talento. Maaaring hindi sila academically inclined, pero nag-excel naman sila sa ibang larangan, tulad ng music, arts, and sports. Ang pagkakamali, pagkatalo, at failure should be expected and accepted. Iwasan po natin ang paghahambing. Bakit yung pinsan mo ganyan siya, hindi mo katulad? Bakit di ka gumaya sa kanya? Ano man po ang kanilang pagkakamali, kailangang tanggapin at suportahan natin. Itama at parati tayong nakaalalay sa kanila. Nurture children's confidence and self-esteem. Purihin natin sila. Kahit po yung maliliit na bagay na kanilang nagawa. Nagligpit ng laruan, nakagawa ng takdang aralin, sumayaw, nakabasa, sumunod sa utos. Atin po silang purihin. Sa ganoong paraan, unti-unti po nating madedevelop ang tiwala nila sa sarili. Tuklasin ang kanilang kakayahan. Alamin ang kanilang lakas at kahinaan. Hindi po puro tagumpay at kasiyahan. Nandyan din ang kalungkutan at kabiguan. Upang sa ganon, matutunan nilang dalhin ang kanilang sarili, anuman ang sitwasyon nila sa buhay. Turuan natin sila na makipagkapwa-tao, makipaglaro, at magkaroon ng tamang interaksyon sa mga batang kagaya nila. Lalo na po ngayon, puro gadget na lang hawak nila pagising pa lang sa umaga. Cellphone na agad ang hawak. Kailangan din nilang maglibang, magsaya, maglaro, makipagkaibigan, habang tinitiyak ang kanilang kaligtasan. Mahalaga pong may partisipasyon o magandang komunikasyon tayong mga magulang sa ating mga guro. Nang sa gayon, sama-sama tayong tulungang matuto ang ating mga anak. Ang paaralan ay ang pangalawang tahanan. Ang mga guro ay ang pangalawang magulang. Ngunit sa kasalukuyang sitwasyon, nabago ang sistema ng edukasyon. Iba't ibang paraan upang maiparating sa atin ang edukasyon ng naaayon sa new normal. Ano nga ba ang new normal? Sa kabila ng kinakaharap na pandemya, iisa ang hangarin natin na isulong ang edukasyon. Ano ang mga dapat isaalang-alang at isaisip sa pagpunta sa paaralan na di tulad ng ating nakaugalian? Una, ang pagsuot ng face mask at face shield sa tuwing papasok sa loob ng paaralan. Pangalawa, ang pagtapak sa footbath upang ma-disinfect. At pag-sanitize ng kamay gamit ang foot-operated hand sanitizer or alcohol. Pagkuha ng temperatura. Kinakailangang ito ay hindi hihigit sa 37.5 degrees Celsius. Walang anumang sintomas na katulad ng trangkaso. Oops! Huwag kalimutan magdala ng sariling ballpen. May ilang mahalagang impormasyon na kailangan niyong punan. At kapag nasa loob na ng paaralan, siguraduhin na may physical distancing, 1 o 2 metro. May mga itinalaga ring lugar o silid-aralan kung saan kukunin at ilalagay ang module ng inyong anak. Sundin ang panuto ng ating mga guro. Matapos ang lahat ng inyong transaksyon, muling maglagay ng alcohol o hand sanitizer at tumapak sa footbath bago tuluyang lumabas ng paaralan. O diba, uuwi po tayo sa ating tahanan na tiyak ang kaligtasan. Ngunit, dahil na rin sa kasalukuyang sitwasyon, ang ating mga anak ay nasa bahay lamang, nanonood ng TV, nanonood ng videos gamit ang kanilang cellphone. Dapat maging alerto at mapanuri po tayo sa kanilang mga pinapanood. Maaaring ito ay hindi angkop sa kanilang edad. Gabayan po natin sila. Alamin at kilalanin din po natin kung sino-sino ang kanilang mga kaibigan. Marami pong kabataan ang napapahamak dahil sa maling paggamit ng social media. Para po sa may mga anak na nasa adolescent stage, let us be their parent and friend. Alamin din po natin kung sino-sino ang kanilang mga kaibigan. Marami sa mga teenagers ang lumalapit sa kanilang mga kaibigan sa tuwing sila ay may pinagdadaanan. Alamin at tiyakin po natin na mabuting kaibigan ang kanilang nalalapitan. Kaya mahalaga po na bilang mga magulang, tayo ay kanilang pinagkakatiwalaan. Iparamdam po natin na lagi tayo handang makinig, umunawa, at magbigay ng payo at suporta sa kanila. Ika nga po ni Brooke Campion, "Speak to your children as if they are the wisest, kindest, most beautiful, and magical humans on earth. For what they believe is what they will become." Mahalin at suportahan natin ang ating mga anak higit pa sa kanino man. Kami pong muli ang inyong nakasama sa talakayang ito. Maraming salamat at panatilihin po nating ligtas ang bawat isa.
Hello and welcome to Self-Care for Parents and Caregivers, a video brought to you by Michigan State University Extension Early Childhood Team. Raising young children can be stressful, and from time to time it can take its toll on parents and other caregivers. Self-care is a crucial way to ensure that adults caring for young children are prepared to invest the time and energy they need to be the best caregivers they can be. If you aren't taking care of yourself, you may not have much time left to give your children. Michigan State University Extension has some suggestions for making sure that parents and caregivers take the time for self-care. Make sure your basic needs are met. In the hustle of trying to take care of young children, parents and caregivers' needs often get overlooked. Think about the energy that you invest in making sure your child's needs are met. You make sure that they get enough to drink and eat, provide enough time for them to get the restful sleep they need, as well as the exercise and time to play. Do you do the same for yourself? Make it a routine. Just like you develop routines for your child, make self-care part of your daily routine. Come up with simple routines you can do to help you relax and unwind and take care of yourself. Maybe it's taking a quick walk a few days a week, or making time to bake if that's a hobby that you enjoy. Start small. Big changes can seem intimidating. Don't think of increasing your self-care as something big you have to do overnight. Break up the tasks into small pieces and find something small to start with, like challenging yourself to drink less caffeine to help you sleep better at night. Try writing down your goals and keeping track of your efforts. This can help motivate you to keep going and is a great way to see your progress. Once you have incorporated that change, try making another small change. Model self-care for your child. Let your child know what you are doing and why self-care is so important. You can tell them, "This is Daddy's time to himself. When I go for a walk alone, it gives me time to think and helps me feel calm and relaxed." Children learn from watching us, and when we show them that we value self-care, they learn to value it too. Investing in your own well-being is a way to invest in your child's well-being. Take the time to nurture yourself so you have the energy and motivation to nurture your child. This article was published by Michigan State University Extension. For more information on child development, academic success, parenting, and life skill development, please visit the Michigan State University Extension website at msue.anr.msu.edu.
Hey there, and thanks for gifting yourself these next few minutes. It's important to remember that you're a priority, and allowing yourself even just a few short minutes of intentional reflection can really have a positive impact on the rest of your day. So let's use these next few minutes to come back to center and set an intention for the rest of your day. Move into a comfortable position, whether you're seated at your desk at work or laying on the couch at home, and gently close your eyes and shift all of your attention onto your breathing, taking slower, deeper breaths than you've taken all day so far. Taking a deep breath in through your nose and slowly letting it out through your mouth. And continuing to breathe that way, feeling your lungs expand out as you inhale and contract back in as you exhale. Tune into your body, noticing how it feels. Noticing if there's anything that it's trying to tell you. Notice any place of tension or tightness in your body. And give those areas permission to relax, sending love into those areas. Thank your body for taking such good care of you, and let it know that it's okay to rest and relax for these next few minutes. You may notice that your mind starts to wander off. That's okay. That's natural. Just notice it and bring your attention back to your body, using your breath as your anchor. Try to picture one thing that's happened today that's made you smile, or made you thankful or appreciative. And just let that feeling fill you up for a moment. Breathe that feeling in from the top of your head to the tips of your toes. And allow yourself to smile if that feels natural. Now focus on something that you can do today, whether it's for yourself or for someone else, that will allow you to continue feeling this way. It could be something as small as deciding to go to bed early tonight, so that you have time to finally read that book that's been on your bedside table. Or the joy of getting dinner with a close friend. What's one little thing you can plan for your day to bring that intentional joy to it? Now just focus on that for a few minutes. Sit in that feeling of joy and peace. Now let's take a few more deep breaths together. A deep breath in, feeling your lungs expand out as you inhale, and everything contract back in as you exhale. Again, an even deeper breath than the one before it, holding that breath for a beat, and exhaling everything out. Last time, your deepest breath yet, sending that breath through your entire body. And exhale it out. And in your own time, slowly bring your awareness back to where you are. And thank yourself for taking these few minutes to just be intentional and kind to yourself. And when you're ready, you can gently open your eyes and enjoy the rest of your day.